Restorative Art, Chapter 6, Facial Markings. This is a Quizlet created by Contessa King. And Contessa is amazing. Contessa's never going to hear this or know that someone appreciates her so much, but I promise you, my classmates and I appreciate these Quizlets. She organized this very nicely and put all the details from the asshole textbook that was scattered all over the place. So we have a nice, organized, concise catalog of information here. So I'm going to be scrolling through her Quizlet on the screen, and there's pictures also. Subcuteness. Situated or occurring beneath the skin. Subcuteness, situated or occurring beneath the skin. Integument, integument. Describes something that covers or encloses, especially an enveloping layer such as skin, membrane, or cuticle of an organism or one of its parts. So integument describes something that covers or encloses. So our skin is integument because it envelops our organs and skeleton, I guess. Fascia is a layer of areolar tissue covering the whole muscle trunk. I had no idea that fascia had something to do with areolas. But for some reason, it's also called a layer of areolar tissue. So yeah, okay, fascia. Glands. Specialized organs that remove certain elements from the blood to convert them into new compounds. So glands, specialized organs that remove certain elements from the blood to convert them into new compounds. Glands are organs. They remove elements and convert them into new compounds. Adipose is loose connective tissue full of fat cells. Adipose is loose connective tissue full of fat cells. Derma, dermis, skin is the word for corium or true skin. Derma, dermis, and skin is corium or true skin. corium, corium. True skin. I guess we have fake skin too. Who the fuck knows? Epidermis is the outermost layer of skin. Epidermis, outermost layer of skin. Identifying facial markings. The character lines of the face and neck, wrinkled grooves, cords, and dimples. We need to state that these markings are caused by muscles and are classified as either natural or acquired. How many natural facial markings do we have? 9. And it might ask that. How are we going to remember that? I don't know. 9 natural facial markings. Now, how many acquired facial markings? There's 11. So that's a little bit easier. You can try to remember the 11s between the eyebrows. Everybody can kind of remember that those are acquired. So 11 acquired facial markings. 9 natural. Oh, there we go. 9 natural, like an N, an N. And 11 acquired because the 11s between the eyebrows. There you go. Influential elements of facial markings. The influential elements of facial markings could be hereditary, age, environmental, muscle striation and action, position of the body, and condition of the body. Influential elements of facial markings. So hereditary. If your mama was wrinkly, you'll be wrinkly. Age. You get old, you get wrinkly. Environmental. If you roast yourself like a rotisserie chicken in the sun 24/7, you get wrinkles, right? Everybody knows that. Muscle striation and action. We were always told when we were kids, if you make funny faces, it's going to get stuck that way. Some wrinkles are kind of like that, especially those 11s. So muscle striation and action, position of the body. You can actually create and increase wrinkles by the way you sleep and laying on your cheek and stuff like that. That's one of the reasons why the silk pillowcases have gotten popular, is because the silk is supposed to help keep the pillow from grabbing your face or something. So position of the body and condition of the body. If you wear yourself out, you end up looking real hard, 50 years old. If you did a hell of a lot of drugs and drinking and partying and not sleeping. Everybody knows that. Condition of the body. Influential elements of facial markings. What is a sulcus? It is a furrow, wrinkle, or groove. A sulcus is a furrow, wrinkle, or groove. A furrow, wrinkle, is a crevice in the skin accompanied by adjacent elevations. A groove is an elongated depression in a relatively level plane or surface. So sulcus is any of the three: furrow, wrinkle, or groove. A furrow or wrinkle, crevice in the skin accompanied by adjacent elevations. A groove is an elongated depression in a relatively level plane or surface. So a groove is not as deep as a furrow. So a furrow is a crevice, and a groove is just a depression. A fold is an elongated prominence adjoining a surface. And everywhere that you see fold, it means natural marking. There are actually a few natural markings that are called sulcus or whatever. I didn't think that there was, but there is a few. For the most part, a sulcus is acquired and a fold is natural, but there's a few exceptions because this is bullshit, Eminence is a prominence or projection. Eminence is a prominence or projection. The 9 natural facial markings include the oblique palpebral sulci. Oblique palpebral sulci. What does that mean? So we know that palpebral means eyelid and sulci means a wrinkle. Oblique means it's neither horizontal nor vertical, but are inclined or slanted. It's like a curving groove. And the oblique palpebral sulcus is a shallow curving groove below the inner corner of the eyelid and moves outward and downward. The nasal sulci, that's the wrinkle groove of the nose. Nasolabial folds. You know that naso means nose and labial means lips. So it's like the fold between the nose and the lips. The philtrum, we know, is the little water slide under the nose holes down to the Cupid's bow. The angularis oris eminence, you look at that, you know angularis is angle, oris is mouth, and eminence is the pooch or protrusion or whatever. Labiomental sulcus, you know labio is the lips and mental is the chin. So it's got something to do with a wrinkle between the lips and the chin. Right out the gate, you know. That's what you're thinking of. Submental sulcus, you know that the mental means the chin. You know that sub means beneath. So it's a wrinkle towards the lower part of the chin. And then dimples. Dimples are natural. You just have to remember that, right? So the philtrum, a natural facial marking, is the vertical groove located medially in the middle on the superior or upper lip. It's a natural facial marking. It's described as it extends beneath the columna nasi or nose holes and the margin of the red lip. So it's like where you put your fucking lip liner, right? The margin of the red lip. The philtrum is with the philtrum, the widest part coincides with the deepest part of the groove. The widest part coincides with the deepest part of the groove. And it may be obscured in extreme old age. Nasolabial fold, natural, is the anterior fold of the cheek which descends laterally, which means to the side, which descends. Sounds like some mythological bullshit. Like the armies of heaven are not descending along the sides of the cheek, you know, but this is how Latin assholes write things. So let me back up. The nasolabial fold is the anterior or front fold of the cheek, which descends, goes down laterally along the side, along the upper lip from the wing of the nose. So it's the fold of the cheek that goes down the side of the cheek along the upper lip from the wing of the nose. So it's just that little fold in the cheek that's always there since you're born, between the nose and the lip and the cheek. The nasolabial fold is an elevation of the anterior or the front of the cheek. It's an elevation of the anterior front of the cheek and typically exhibits a curved, straight, or sinuous outline. Your cheek is not full of sin. I think that's a fancy bullshit word for running along the outline of the nose. Sinuous, whatever. The nasolabial fold is often associated with the creation of an individual's norm. And there it is. Nasal sulcus, which is natural, is the angular area between the posterior or back margin. Let's back up. The angular or angled area between the back margin of the wing of the nose and the nasolabial fold. It is the angular depression in the uppermost part of the upper lip. The corner of the angle is formed by the junction of the wing of the nose and the nasolabial fold. So it's that little curved area between the cheek and the wing of the nose. Oblique palpebral sulcus, natural. Remember, oblique means curving, neither horizontal or vertical. They're inclined or slanted or curving. Oblique palpebral sulcus. And of course, palpebral we know is eyelid. The eyelids are curved, hence oblique. It is the shallow curving groove below the medial or middle corner of the eyelids, a natural facial marking. The oblique palpebral sulcus forms the common border for the medial or middle portion of the infraorbital area and the side of the nose. It originates immediately below the medial canthus or middle canthus and extends along the bony margin of the orbit, fading in depth, normally terminating near the middle of the eye. Oh, I guess there's not a picture for that one. Angulus oris eminence, which is natural. So we know angle of the mouth that protrudes. It's the pooch pooch by the angle of the outside of the mouth. The definition is the small convex prominence that is lateral or to the sides to the end of the line of the lip, closure of the mouth. It's also described as being located to the outer side and slightly above the corner of the mouth. It is formed by insertions of the zygomatic, which is the cheek muscle, the buccinator, succinator, blowinator cheek muscle, and depressor anguli oris, or muscle at the angle of the mouth that pulls down. Angulus oris eminence. Angulus oris sulcus is the groove found at each end of the line of closure of the mouth. Immediately below each end of the line of closure of the mouth, and it is a natural facial marking. Angulus oris sulcus. So we know angle, mouth, wrinkle. When you see angulus oris sulcus. Groove also means wrinkle. They just like to use a whole bunch of different words for the same stupid fucking thing. The groove found at each end of the line of closure of the mouth. Like the Joker spots. Immediately below each end of the line of closure of the mouth, and it's natural. The size and depth varies based on the degree of prominence of the angulus oris eminence. So the angulus oris eminence affects the angulus oris sulcus. Labiomental sulcus, natural. The lips and the chin wrinkle. The junction of the lower integumentary lip, and it's going to be the lower integumentary lip because that's where your freaking chin is, right? Right? And the superior border of the chin. Labiomental sulcus. It is between your bottom lip and the top of the chin. which may appear as a furrow and is a natural facial marking. The linear form creates an arch with the uppermost part at the median. The median or middle line. Submental sulcus, which is natural. Sub, means like bottom, and we're not like talking kinky stuff. Sub means just like below, in general, like submarine. Mental is chin. Sulcus, wrinkle, furrow, groove. This is natural. It's the junction of the base of the chin and the submandibular area, which may appear as a furrow, and that is that part. Dimples are shallow depressions located on the cheek or chin, rounded or vertical form, and dimples are always natural. The cheek dimples are on the transverse plane. The chin dimples are on the median line. An elongated chin dimple is called a cleft, and the fancy name for a double chin is a bilbobated chin. I don't know, double chin like Bilbo Baggins, I guess. The acquired facial markings, 11 of those, include the nasolabial sulcus. Notice how for the acquired, this is nasolabial sulcus, and the natural was nasolabial fold. So in this case, it makes sense. Transverse frontal sulci, interciliary sulci. Transverse frontal sulci is the ones that run across the forehead. Frontal bone, transverse, running across. Interciliary. Ciliary's got something to do with the eyebrows, and inter means in between, so it's the wrinkles in between the eyebrows. Optic facial sulci, that's the acquired wrinkles around the eyes. Superior palpebral sulcus, that's the upper wrinkles of the eyelid. Inferior palpebral sulcus, the wrinkles around the eye at the bottom. Bucofacial sulcus, that's the buccinator cheek thing with the trumpeter dude wearing out his cheeks, giving himself bucofacial sulcus. Mandibular sulcus just has to do with the jaw. Platysmal sulci, remember that's the platypus tail that covers the neck down to the collarbone. Cords of the neck, that's the wrinkles running across the neck. And labial sulci, which is lip wrinkles. Nasolabial sulcus, which is acquired, is the furrow lying medial to the middle and adjacent to the nasolabial fold. So it's right next to the nasolabial fold. It originated with the nasolabial fold at the superior margin of the wing of the nose and may extend downward along the margin of the nasolabial fold. There it is. Transverse frontal sulci, furrows that cross the forehead, horizontal forehead furrows of the forehead, acquired. Transverse frontal sulci. Interciliary sulci, acquired. The vertical or transverse furrows between the eyebrows, Vertical interciliary sulci extend from the root of the nose superior beneath the eyebrows into the glabella. So the 11s have to do with the glabella and the root of the nose. And from the continual contractions of the corrugator muscle is where the interciliary sulci come from. Continual contraction of the corrugator muscle. That's what, moves the little gator body up between the eyebrows. That's what it looks like in the pictures. Transverse interciliary sulci begins at the root of the nose and the dip at the bridge. And it's from continual contraction of the procerus muscle. So transverse interciliary sulci can also be from the contraction of the procerus muscle or the corrugator. And there's the 11s. Optic facial sulci, which is crow's feet and acquired. Eye wrinkles. Optic facial sulci is the crow's feet. That is the furrows radiating laterally to the sides from the lateral side corner of the eye. It deviates from develops from the contractions of the orbicularis oculi muscle. The butthole eye muscle creates the crow's feet. Generally is the first acquired facial markings to appear on a person as they age. Superior palpebral sulcus. So we know upper eyelid wrinkle right off the gate, just looking at it. The definition is the furrow of the superior border of the upper eyelid. May be partially obscured from sagging skin later in life. And there it is. Inferior palpebral sulcus. So looking at that, you immediately know lower eyelid wrinkle right out the gate. But the fancy dumbass definition is the furrow of the lower attached border of the inferior palpebra. That's a lot of fancy words to say the lower eyelid wrinkle. Let's hear it again. The furrow of the lower attached border of the inferior palpebra. Okay. So it's not always present, especially when tissues are firmed from embalming. Appears as thin, shallow, arched sulci or wrinkle along the attached margin of the inferior eyelid. There it is. Don't let all these dumb words intimidate you. It's just simple people making things sound more complicated and intelligent and difficult than what they are. Bucofacial sulcus acquired. Buco, we already know buccinator, suckinator, blowinator, dude on the trumpet blowing out his cheeks. So you know it's got something to do with the cheeks, wrinkling in the cheeks. The definition is the vertical furrow of the cheek. Easy peasy. It originates in the soft middle area of the lateral or side cheek, caused by contractions of the buccinator muscle. Superiorly may merge with the oblique palpebral sulcus. So at the top, it might run into the curving wrinkles, oblique is curving wrinkles from the eyelid. So you know that the wrinkles from the cheek, if they run into anything, the first thing they're going to run into is the wrinkles along the bottom eyelid. And it curves up with the eye, so oblique palpebral sulcus. And the buccofacial sulcus inferiorly at the bottom may also merge with the mandibular sulcus, because you know down there is where the jaw is, and the cheek connects to the jaw down there at the bottom. The mandibular sulcus, the furrow beneath the jawline. Mandibular, you already know jaw, but you got to remember that it's beneath the jawline. The term doesn't really indicate superior or inferior on the jaw. So you just got to remember mandibular wrinkles, right? Mandibular sulcus is the furrow beneath the jawline, which rises vertically on the cheek. If multiple sulci present, it equals a serrated jawline, which is a word for angular notches that separate multiple folds of sagging skin. There it is. Labial sulci are also called furrows of age. Labial, you know it's lips, lip wrinkles. But these are the main character lip wrinkles, the labial sulci, because they're the furrows of age. The vertical furrows of each lip extending from within the mucous membranes into the integumentary lips commonly occur first on the upper lip. These form as the lip begins to atrophy, and they extend from within the red lip into the integumentary lip. So we've all seen this on some old people. Jamie Lee Curtis has got this going on, unfortunately. Platysmal sulci acquired. This is the transverse dipping furrows of the neck. It runs across both the front and sides of the neck. Platysmal sulci. Cords of the neck are the vertical prominences of the neck. Vertical prominences of the neck are the cords. For some reason, when I think of cords of the neck, I think of like being strangled by a cord and that it's going to be horizontal, and that messes me up. This is vertical. It's like cords going up your neck, connecting your collarbone to your head, you know. Cords of the neck are vertical. It's not getting strangled. Cords of the neck on thin, emaciated individuals may run all the way to the sternum. There they are. And that's it.